Good afternoon, all. My paper is on the spectrum and management of dry eyes in patients with thyroid dysfunction. So, what is dry eye disease? It is characterized by an abnormal tear film that disrupts the ocular surface, causing symptoms from discomfort to visual disturbances. Dry eye was one of the most common symptoms among thyroid dysfunction patients. The primary aim of my study was to evaluate severity and clinical patterns of dry eye diseases in patients with thyroid dysfunction. Secondary aim was to assess the therapeutic response after 2 months of targeted ocular surface management. Study design and methodology. This was a hospital-based observational study conducted at the Department of Ophthalmology. Patient selection was based on consecutive sampling of patients with confirmed thyroid dysfunction. Inclusion criteria was all patients with confirmed thyroid dysfunction regardless of duration. Exclusion criteria were age below 20 years, autoimmune disorders, drugs that affect thyroid function, radiotherapy patients, previous ocular surgeries, contact lens wearers, and pregnant patients. Assessment. After getting informed consent, we took a detailed thyroid history followed by a OSDI questionnaire. A detailed ophthalmic evaluation was done, which included dry eye evaluation test. Based on the inference of that, a targeted lubrication therapy was given, and patient were called back after 2 months. On follow-up, thyroid function test as well as dry eye evaluations were again reassessed. Coming to type of dry eye, we have normal, evaporative, and mixed type of dry eye. And based on severity, we have a normal, mild, moderate, and severe dry eye. The diagnostic tools which I used in my study were OSDI questionnaire, Schirmer test 1 and 2, then tear film breakup time, and corneal fluorescence staining. Now coming to the results, there were 312 participants in my study with a mean age of 43.63. There were 250 females and 62 males. The majority of the age group belonged to 31 to 40 age. Thyroid status at baseline, there were 163 euthyroid patients, 82 hyperthyroid, and 67 hypothyroid. On comparing thyroid status with gender, it was equal among males and females. Lubricant status, at baseline, there were 146 patients already who were using lubricants. OSDA score showed 142 asymptomatic patients initially, 77 mild, 33 moderate, and 60 with severe dry eye. On comparing the lubricant use with OSDA score, patients who did not use lubricants were significantly present in the moderate and severe category. Coming to objective dry eye type classification, on integrating Schirmer 1, 2, and T-BUT, we had 176 cases of evaporative dry eye, 26 cases of mixed dry eye, and there were 110 cases who were normal. Coming to corneal staining pattern at baseline, there were 78 cases of severe dry eye, 54 cases of moderate dry eye, 70 cases of mild, and 110 cases were normal. On comparing corneal staining pattern with thyroid status, majority of the patients who were normal came from the euthyroid group. And hyperthyroid and hypothyroid patients had severe corneal staining pattern, but a significant proportion, that is almost 50% of euthyroid patients also had some form of corneal staining pattern. Now coming to the targeted lubrication therapy, patients were managed initially with 0.5% carboxymethyl cellulose 4 times daily, and if the symptoms persisted, it was increased to 6 times, and it was again escalated to 1% CMC for continued symptoms. Patients who were identified as aqueous deficit or mixed type of dry eye were directly started on 1% carboxymethyl cellulose, and if symptoms were persistent, then we added 2% HPMC eye ointment. On follow-up, thyroid status, hyperthyroid and hypothyroid groups declined in number. Euthyroid patients increased from 163 to 231, showing a 41.7% improvement. Follow-up OSDA score, at baseline there were 142 asymptomatic cases, which improved to 220, and the severe cases at 60 from baseline declined to 5 severe cases. And the analysis was clinically significant. The involvement of lubricant therapy. Now coming to dry eye progression, at baseline combined dry eye, there were 26 patients, of which 3 remained in the same category and 23 progressed, improved to the evaporative type. And among the 176 evaporative people at baseline, there were 86 of them remained in the same category and 90 improved to normal. And among the 110 normal eyes, 82 remained in the normal category, but 28 developed evaporative dry eye. And according to corneal staining pattern, in baseline we had 78 patients with severe dry eye. On follow-up, only 7 were in the same category, 48 improved to moderate, 22 improved to mild, and 1 patient had achieved normal eyes. And among the moderate dry eye, which were 54 in number, 2 remained in the same category. 26 progressed to mild, and 26 of them achieved normalcy. All grade 1 in mild category remained improved to normal category, and normal patients were 110 number. Only 1 worsened to mild dry eye. Coming to lubricant status, at baseline there were 146 patients who were using, and on follow-up 298 patients were using lubricant drops. So here you can see the lubricant drop distribution. There were 14 patients who didn't receive any drops at all, and the highest concentration, that is 1% CMC with the 2% HPMC ointment, 11 patients received that. Now coming to discussion, our study predominantly included females, 80.1%, which is consistent with the reports by Ramakrishna et al., Garib et al., and Sabita et al., and also consistent with global patterns. Coming to our study, 54.5 patients had dry eye according to OSDI score, and 64.7% had dry eye according to T-BUT. According to Kashkauli, Khan et al., and Paharia et al., they found it reverse. They found OSDI score to be more than the T-BUT scoring. And corneal staining patterns, 64.7 patients showed corneal staining, with 25% showing severe staining pattern. Kashkauli also had 35% patients with corneal staining, and 24 of which were severe. And corneal staining grade 2 to 3 was more frequent among the younger females in our study. So advantage of our study was we had a follow-up, and it showed improvement in euthyroid status,
Mathew,
increase in the lubricant.
time is up. Time is up, I guess, right? So conclude.
Yes, sir. So to conclude, thyroid dysfunction is a multisystem disorder, with dry eye being the prevalent manifestation, and requires combined management, thyroid normalization as well as ocular surface therapy, and it's an interdisciplinary approach between an endocrinologist and an ophthalmologist. Shortcomings were we had a really short follow-up period of 2 months. Moving gland dysfunction was not assessed. TR biomarkers, TRAB and TR osmolarity were not studied. These were my references. Thank you.
Of your patients, how many had this associated digital syndrome? They must be working on screen for a long time, right? Did you remove that confounding factor?
Sorry, ma'am, which component factor?
Computer vision syndrome. They would be having that too, right?
The age group, ma'am, majority of the age group is 31 to 40. So mobile, that
mobile, work or profession are also there, right? Screen time because of profession.
We didn't take that into consideration,
That
ma'am.
must be.
Throughout the study, we're saying it improved to improve 2 months. What was the comparator? Improve with what?
So based on the initial finding, we've got all the patients' initial values, and then when we follow them with the based on the OSDI scoring, the T-BUT and the corneal staining
So
pattern.
baseline you measured everything.
Yes, sir.
Then you're presenting data, na? In 6 months they improved to normal. So what?
Then we did the statistical analysis, and it showed.
So it was a follow-up study.
It was a follow-up study.
Prospective interventional, I would say, because you started lubricating in those patients.
Yes, sir.
Right? So it was a prospective intervention study. You took all patients with thyroid disease.
Yes, sir.
Then you gave lubricating drop, and then you evaluated, right?
I evaluated them.
And what was that euthyroid group?
Euthyroid group patients, like some of them had dryness. So initially, patients for dry eye evaluation, they have to have a normal thyroid status, as well as patients should use lubricant drops. So some of them were not using the lubricant drops properly. So once we started the study, we told them you have to use drops accordingly.
No,
and
do they have, if those group had some thyroid disease and then they were euthyroid medication or what? That is my query.
No, they became euthyroid on medication.
So those were thyroid patients.
Yes, sir. Yes, sir.
But after medication they were under control.
Under control.
Say, right?
Yes, sir. Yes, sir.
Then you could have done a comparison with your euthyroid group versus those groups where the thyroid was not controlled. Okay. That would have given you a better information. If you control the thyroid, dry eye disease is controlled. If you don't control, then dry eye is worsen. That will give more information. Maybe next time when you present, you do that analysis.
So we are actually done with the diagnosis of thyroid. We have divided the thyroid based on diagnosis, like Hashimoto, autoimmune versus non-autoimmune. At that time, we found all the autoimmune conditions, they maintain the euthyroid state, but those patients had corneal staining pattern, as well as the.
Okay, thank you.
Yes.